Hello, this is Dr. Judy Sedgman, and welcome to Public Health 580, Prevention Through Resiliency. I hope you'll watch this brief clip through to the end because I'm going to try to give you an overview of the course, why it's important, how it fits into the context of our work in prevention, and how it's part of a very quickly developing field of endeavor that is going to deserve your attention for years to come, actually, as it changes and new ideas emerge. When I first started to conceptualize this course, which is when I first came to West Virginia University in 1998, actually, there was almost no connection in the literature between stress as a condition of human experience and people's well-being and general health. Stress had come into the world via the sort of the popular psychology route. The word stress really wasn't even used in connection with human experience until the mid-1950s, when the researcher Hans Selye entered the arena and began studying the effects of various external pressures on rats, and referred to these external pressures as stressors, and started to use the term stress. Actually wrote a book called Stress, which emphasis was in the title type, which became very popular. And at that point, researchers in the behavioral fields began inquiring, what do you find most stressful, going to the dentist or public speaking, and so on and so forth. And really, the whole notion that stress was something that people suffered from was fairly new and fairly fringy in terms of what the true scientists were looking at. But over the course of the years since the turn of the century, basically since the year 2000, everything changed. And it started to change in 1999 when a study known as the HERO study, HERO, standing for Health Education Research Organization, began to be well known. And that study was commissioned by the insurance industry. It was HERO was a group of university-affiliated researchers who were essentially working on commission or at the request of the insurance industry to study what factors were the primary contributors to escalating healthcare costs. Because, of course, even back then, people began to notice that our healthcare system was out of control and the costs were going faster than we could imagine. Well, they were expecting lifestyle. They were thinking, well, we're going to see whether it's smoking or eating habits, or whether it's polluted air or whatever it might be. Well, when they completed the study was actually led by a man named Ron Getzel. And when that study was completed and he began presenting it, it turned out that by a long difference, by a huge difference, the primary contributing factors to escalating healthcare costs were depression and stress. And people were astonished. I mean, at that time, and it seems kind of self-evident now because probably since you've been studying, it's been very obvious, but at that time, the entire prevention field was like, what? How could this be? People were very shocked by that. But it definitely opened the door to a lot of new studies and new research. It sort of was the seed that was planted from which flourished the entire field of psychoneuroimmunology. The idea that the mind and the body are deeply connected, and that there is enormous amount that we don't understand about how our psychological activity affects our physical well-being. And at that time, people began being frustrated by the fact that, the two things that were most costly in terms of self-reported problems that were affecting people's usage of healthcare services for other things were not very well understood and really not that easy to imagine getting rid of. So it's interesting because at that time when I first came to West Virginia, I came at the invitation of the then dean of the medical school, because I was working in a very new field which addressed stress at its root cause. And we, at that time, insisted that there was a much stronger connection between stress and other health problems than was being acknowledged. But, we were kind of alone in that. I mean, and then gradually, we kind of got invited to the bigger party. So as I began developing this course, has changed radically year to year to year because the literature is expanding so fast. The sophistication of our ability to do research into the mind-body connection is changing year to year. I mean, when this first started, you generally couldn't tell much from fMRIs, or, people weren't thinking of CAT scans as a research tool. And now we really can study brain activity in real time. There is so much more known about the electrophysiology of the brain, and of the links between various brain chemical changes and things that happen in the body. This is all fairly new information. But as this is developed, the field of prevention is waking up to the fact that if we could address the issue of stress, if it were really possible to prevent stress in the first place, or eliminate stress in a large majority of the population that suffers from it, we would dramatically influence healthcare costs. But not only would we dramatically influence healthcare costs, we would incredibly impact the quality of life that people have. Because it's now very clear that living in a stressed state of mind, day in and day out, is not only bad for your health, but it also creates a very unpleasant experience of day-to-day interactions, of our ability to deal with issues as they arise, of our relationships with our children and our families and our friends and our colleagues, of our creativity, of our capacity to get new ideas and have the courage to try them. So there's a real downside to the enormous impact and the widespread experience of stress right now in our society. And so thus was born the field of resiliency. There's an enormous amount of literature now about resiliency. Now, the interesting thing about resiliency is that people started studying it in the same way they started studying stress. I mean, sometimes when you think about research, you really have to think about what were the underlying assumptions when this research began. For example, when Hans Selye began researching stress, and again, he only studied rats, he made the assumption that stress in human beings was analogous to stress as it was used as an engineering term. And as an engineering term, it really meant the ability of physical things to withstand various types of pressure. So the ability of a structure to withstand wind, or the ability of steel beams to withstand the pressure of weight and that sort of thing. So he decided that, well, when we study stress in human beings, then we're going to study how certain external things affect people, what happens, what's the impact on people. Well, that's a research assumption. And once you start with that assumption, you never question from that point on whether your assumption was based on any sort of logic. You just pick an assumption. We all do that. But it's an important thing to ask yourself, what if he had assumed, for example, that stress was an artifact of the human imagination, applied to external things? His research would have gone a whole different direction. And for one thing, he couldn't have done it with rats because we have no idea what they're thinking. But nonetheless, given that he started that way, when psychology turned around, and that really happened in the year 2000, when the American Psychological Association came together, and under the leadership of Martin Seligman, actually, the American Psychological Association said, you know what, we're not really getting far studying illness. We know everything there is to know about illness. And we still haven't really cured anybody. We provided relief, we've done some good things, but we're missing something. And the field of so-called positive psychology was born. But when that field was born, which led to all these studies of resiliency and their studies of positivity, again, the assumption was made, because that was the assumption of the negative studies, that positive things came at you from the outside. So most of the studies of resiliency, as you'll see when you get into the literature, most of the studies of resiliency have had to do with what can we put into people to build their resiliency. How can we impact people in such a way that they feel more resilient, or they act more resilient, or they whatever. So again, the basic research assumption was it's from the outside in. We put something into people, and when we put it into them, it makes them more resilient. Or we teach people something, and when they learn it, they are more resilient, or they have the tools that they need to be more resilient or to behave better. So again, if you look at the research, and you will, you have to say, what is the underlying assumption? Now along comes the field that I'm representing and that you're going to be looking at in this course, which is the emerging answer to why we still haven't solved the problem of stress. And this field is primarily known now as innate health. If you go back into the literature, you'll find it referred to years ago as psychology of mind. You'll find it referred to as health realization. And then the one common denominator that you'll find if you're looking to see, am I looking at related information about this field, is that it's based on the assumption that our thinking creates our experience, that our capacity to think and use our imagination to make thoughts up and then see them as real, that is the source of our experience. It's not coming at us from the outside. It's coming through us from the inside. So that's the common denominator. The common denominator are these logical principles that describe the nature of thought, the way in which people's psychology actually works. Essentially, as I often put it to people, it says there's no bad thought fairy dripping all the terrible stuff into your head. We're creating our own thinking, and then we see it as real in the moment. Now, that's a complete reversal of a lot of the current or the currently prevailing assumptions. It's a reversal in this sense that just ask yourself, what if there was some truth in that? Then the answer to eliminating stress, the answer to preventing stress, would be within the grasp of human understanding. It wouldn't depend on fixing things on the outside. It wouldn't depend on putting things into people. It would depend on the ability to help people to see something for themselves that set them free from being victimized or dependent upon external things. And that's really the essence of what we're going to explore in this course. Is there some possibility that that's the case? And if that's the case, how would that be applied in the field of prevention? How would we incorporate that into the way we interact with people, the way we present materials and information, the way we train health professionals, the way we work with young students so that they don't fall victim to their own lives before they even have a chance to realize who's making it up. Now, to me, I've been involved in this field for almost 30 years. And when I first stumbled across it, like most people, I was pretty academic. I was pretty skeptical. I'd been a newspaper investigative reporter and then an editor, so I had a high level of skepticism about almost everything. I started every investigation into anything I looked at with the idea that something screwy was going on. There's something behind this. And so it wasn't easy for me to say, well, what if? It was easier for me to think of the reasons why something wasn't a good idea or wasn't going to work out or wasn't likely to be effective. But you know what? I also was smart enough to know that a lot of new things come into the world in kind of offbeat ways. And you can't discount discovery. You can't discount discovery. You can't say, well, there's nothing to it because I never heard of it before. Because that would halt human progress. I mean, that just isn't a very good strategy for going about the evolution of human thinking. So when I looked at it, I primarily looked at, okay, I'm going to look at, does it actually work on or with people or populations that I personally don't think it should be able to help. Just given what I've studied in school and what I know about life and what I assume to be true. So, does it actually, is there any possibility that this works? Well, you know what? It was very, very stunning what happened because, yeah, I discovered that there were all kinds of people who I would have written off, who I would have said, this person's been in mental institutions for 25 years. This person's been in prison on and off for their whole life. This person has got a chronic terminal disease. They're not going to get better. Of course they're depressed. Of course they're not resilient. They know their life is coming to an end. And yet I witnessed, and I've included some videotapes in this course for you to see for yourself, various people who have been affected by this work talking about how it worked for them, because it is hard to believe and it is almost easier to hear it. You can hear it secondhand or you can hear it firsthand. Firsthand is better. But yes, I saw some amazing changes in people that I would have said, given my previous assumptions, would never be optimistic, high-spirited, cheerful, resilient, at peace again. So I truly do believe that we can come together and put an end to stress in our lifetime. And I really am very excited about the work that I do. I'm very excited about the opportunity to teach this course. And I hope that you'll approach it with an open mind and an open heart in the spirit of what if. If there's nothing here, if in the end of it you say, it doesn't, I don't believe this. What have you lost? You've learned about something you're going to hear more and more about as the time goes by. If there is something here, it's conceivable that you could change a lot of lives. So if you could approach it that way, with just that little crack in the intellectual barriers that we all build around our thinking, the little crack that says, well, what if? Then I hope you'll enjoy the course. Please feel free to contact me at any time. I'm sorry I don't get to meet you personally. I live in Florida now. I'm sitting in my den right now in Bradenton, Florida. I have included my email addresses, my home phone number, my cell phone number, and honestly, while I'm teaching the course, I'm very happy to hear from you. Email me. I'll try to get back to you as quickly as possible, or call me if you need an answer right away. I really want to stay in touch with you. I provide a lot of opportunities for us to communicate in writing in this course, and I really hope you enjoy the course. I hope you get something from it personally, and especially I hope it affects your professional life going forward. So now, get going and see what happens.